Ryan. September is Fall Prevention Month. What are the risks and what can be done to prevent serious harm from falls? Here to talk about this is Dr. Stephen Davis, an orthopedic surgeon at Hartford Hospital's Bone and Joint Institute. Doctor, welcome.
Thank you for having me.
Thanks for being here. So why is fall prevention so important?
Well, unfortunately, in the U.S., people over 65, about 1 in 4 will have a significant fall every year. And we see millions of ER visits and hospitalizations that result from these falls every year, and they can result in very severe injuries. Falls in adults over 65 are the most common reason for injury-related death in the United States every year.
Wow, that is very eye-opening. All right, what sort of injuries do you typically see after falls?
We see a wide variety of different injuries. In orthopedics, we're most concerned with broken bones. We see about 300,000 hip fractures per year in the United States. A hip fracture is what we're most concerned with because almost all of those will require hospitalization and surgery. Unfortunately, almost 10 to 15% of hip fracture patients will die actually within 1 year of the injury for a variety of different reasons. And so it's very important to try and prevent falls, as the most common reason for a hip fracture is a simple fall from standing.
Okay. How can people prevent falls? Give us some good tips.
Well, it's mostly common sense, honestly. There are a lot of different things around the home that are tripping hazards: extension cords, loose area rugs, loose thresholds. These are common things that people trip on in the home. Another problem that I see is patients falling going to the bathroom in the middle of the night. So if necessary, put night lights to illuminate the path to the bathroom from the bed. Don't walk on wood floors in socks that can make it very slippery. And then especially with wintertime approaching, having good shoe wear is important, especially as we start to get some ice and snow. A simple device that I advise a lot of my patients to get is something called crampons. They're little metal spikes that you can buy that will strap onto your shoes that will give you more traction in the snow. You can get those at any sporting goods store. And then also exercise is the best way to stay strong and keep good balance and coordination to help prevent falls before they happen.
Great advice. All right, that was a lot of good information. Now, we understand the Bone and Joint Institute from Hartford Healthcare has a webinar coming up about fall prevention. Where can people go and how can they learn more?
You can visit the Hartford Healthcare website. We'll be doing a webinar in October where we'll be talking about the treatment of fragility fractures, fall prevention. We'll have lectures by myself on the treatment of hip fractures. We'll have lectures about nutrition and bone health, osteoporosis treatment, and basically all the different facets of how to prevent falls and bone health and preventing injuries.
All right, Hartford Healthcare orthopedic surgeon Dr. Stephen Davis, thank you once again for being with us.
Thank you.